Hi, my name is Tina Chavez, and this is my introduction for um, the evidence-based inquiry for scholarship and practice. The course number, sorry about the camera, is MSN 563. My educational experience, I have been an RN for 6 years. I just newly obtained my BSN back in July of last year. Prior to that, I was an LVN for 8 years. And prior to that, I was a CNA for 11 years. So most of my work experience has been in the healthcare field. As far as my clinical experience goes, my LVN and my CNA experience were all in really long-term care, because that's all that Texas would allow us to work in with those credentials. When I obtained my RN, I came to Arizona, and I worked in geropsych, inpatient, at the hospital. I did night shift there, and I worked there for 2.5 years. I then went to outpatient-based clinics for neurology, and I've been there going on almost 4 years. And in the mix of that, I kind of do a little bit of home health as well. So I have some limited, some varying experience. My experience with evidence-based practice has been in infection control with hand hygiene, barrier protection, using the Clotty experiment, and we also do full room wipe downs after each patient in the neurology clinic. Another evidence-based practice that we've done within my clinical experience is the nurse-to-nurse shift change. There's a lot that goes into that, and a lot of things that weren't being passed off in shift reports about our patients that were vital and important for the next shift care. Another thing is they try to do the bed by bed nurse rounding to do the report, but we ran into the HIPAA issue, and we were violating a lot of the HIPAA rules when it came to patient information and not having the other patient listen to what we're saying about the other patient. In the outpatient-based clinics, we do a lot of the care rounding. We decided we had our hospital was getting low scores on the patient satisfaction ratings. So we had to come up with an idea of something to help increase our scores. A lot of our complaints with our patients was the wait time. So we decided to do a care rounding trial with that. And with that care rounding, what we would do is we would often go in and we would check our patients while they're sitting in the room. We would offer them snacks and water, and just check on them and just update them to let them know if the doctor was running behind or if they were next. And we provided reading materials in the room to help them pacify them for their time. Our patient ratings did go up about 9 points. We went from an 81% to a 90%, and that was over a 2-month period. And now I believe we're at 93%, and we've been level at that for a month or two now. We're always looking for ways to find new things to do to improve our patient care. And that's where this class will be helpful, because it's all about the evidence-based care. And with this class, I feel like we're going to be able to find out things and learn things of what we can do, how we can justify what we've done and what we've learned, and pass that on to help our patient satisfaction ratings to go up, to make safer patient care, and to lower costs in the medical field. The next question was to describe what would be interesting to me to do my capstone project on. And I think one thing that we need to do is improve the medical knowledge about the diseases, the childhood diseases, HPV, mumps, measles, given that we're having so many outbreaks of these, and the vaccines, and just educating the patients and the families and letting them know the importance of having their children vaccinated. Another thing that I thought was pretty interesting was the prevention of type 3 diabetes. Until I was reading some capstone project ideas, I was unaware that a type 3 diabetes even was out there. So to me, it's pretty interesting. And I kind of looked into it, getting ready to try to do my introduction. And it says that they're linking the Alzheimer's disease with the type 3 diabetic. And so to me, to be able to present information and find out information and evidence about this would be really interesting. My goals for this class are to learn how to correctly evaluate and research evidence, and to be able to do it comfortably. I remember when I first went back for my BSN, learning how to master the APA model of writing style was important to me. And I finally kind of have that down. So now I'm kind of really interested in learning about the correct method and how to apply the PICOT for quantitative evidence. Two personal things about myself. I've been married for 25 years. We live in Arizona. Currently, my daughter, single mom, lives with me with her 3 grandkids. So I'm helping her raise them, because it's not an easy job. So that, along with school and my full-time job and my part-time job, kind of keep me busy. Another thing about me is I love the beach, and that's one of the reasons why I chose United States University to obtain my MSN. That way, when we go there to do our things that we have to do at school, I'll be able to go and visit the beach as well. I found United States University through Aspen University, whom is a sister university. That's where I obtained my BSN from, and they introduced me to United States University, and I've found this school to be fair and concise so far. Anyways, that's my introduction. I look forward to spending time with you guys and doing discussions in this class. If there's anything that I can do for any of you, please don't hesitate to ask. If there's something that you feel like I could do better at myself through our discussions, then please let me know. Thank you guys and have a good semester.